1 in 5 children experiences a mental disorder during the course of a year. That's according to the CDC. And that's why we are partnering with East Tennessee Children's Hospital to shine a light on that growing problem. Anchor Katie Inman explains how the hospital saw more mental health patients than ever before last month and how that spike is straining the staff.
Here, caring for kids comes from the heart.
It's a great place to work, great place to be.
But it's the hands that actually heal.
And I really felt like I could make a difference.
Ron Phillips is the Chief Nursing Officer for East Tennessee Children's Hospital.
I have been with Children's Hospital for about 38 years.
Since he started, cases and children have changed.
One of the things that's markedly different right now is the impact that behavioral health has had.
A spike in mental and behavioral health cases stepped up over the last few years.
Across Tennessee, there was about 20% of all high school kids have contemplated suicide. That wasn't something we talked about 30 years ago.
It's a statewide surge in depression, anxiety, and eating disorders.
Our future is setting in our middle schools and high schools right now, and those kids are hurting.
So are staff.
It's very stressful. Most of us went into pediatrics to do pediatrics. We didn't go into pediatrics to do psychiatric care.
The emotional toll it takes on his nurses is something they can't leave behind when they clock out.
We are a medical facility. We're not a psychiatric facility, so it taxes them physically and emotionally.
Still, they treat every kid who sits in these seats.
And it's so complex. The nursing staff does a phenomenal job of doing it, but it is a very different world than a medical issue. It's not like we can give you something and make you better. We can do something and make you better. It's just not that simple.
That's why they hope the hospital's new mental health initiative is a sign of more support.
We've got to do more. We all know we have to do more, but we have to stop saying we need to and start doing. Our mental health fund is going to be the first step at us doing something different and thinking we'll have a different result.
Money raised to fund more staff, resources, and care starts with a single step.
So as a community, we have to step up and say we have to do more.
So the hearts and hands can keep caring for kids. In Knoxville, I'm Katie Inman.
Children's Hospital has a goal of $50,000. Every penny will go toward improving the mental and behavioral health care for children. If you would like to donate, we do have a link on our website.